Welcome to the Camp Soberfest podcast, where recovery, connection, and community come to life. We're taking you behind the scenes of upcoming events, sharing stories from attendees and sponsors, and proving that sobriety can be joyful, adventurous, and deeply connected. Because connection is the opposite of addiction, and nobody has to do this alone. Hi, everyone. I am Breezy Nolan, the founder of Camp Soberfest, and today we are interviewing our sponsors of Camp Soberfest Texas, and I am so excited to introduce Kaela with Brightside Health.
Hi.
Hey, girl, hey. Can you give me a quick, brief synopsis of what Brightside Health is and what your title is?
Sure. Brightside Health, we're a nationwide telehealth company. So we do psychiatry and therapy for adults and teens in all 50 states. And then we have services for 18 plus in all 50 states. That's a suicide prevention program. And additionally, in 23 of our states right now, which will continue to grow, we have our IOP programming, mental health tracks, and substance use disorder.
So for people who don't know what any of that means, can you break that down?
Break it down a little further.
Yes.
Yeah. Well, I'm assuming they know what psychiatry and therapy would be. We would hope med management and talk therapy. So we offer that for anybody who's kind of going through some difficulties in their life for a variety of reasons, whether that be depression, substance use disorder, or otherwise. And then our IOP services, that's an intensive outpatient. So it's a IOP 3, which means that they're receiving group therapy 3 days a week. Virtually. Everything we do is telehealth. That's our specialty. We build all of our own technology. We use that to help support not just the individuals in our care, but those who are providing the care. And then those of us who are working in other facets, it helps us get the patient experience to be, or we call them members, but the member experience to be more interactive. It helps them track their symptoms. It helps them learn about maybe when they need to get medications changed sooner. And also they enter some lesson work through the app and things like that when they're in that IOP level of care. And additionally, if they're in the intensive outpatient with us, they're going to receive individual therapy and psychiatry as well. And yeah, when they're done with that, they can stay with their therapist and psychiatrist.
Who is your ideal client?
Well, it depends what they're coming in for. So because Brightside started out really working with acute mental health challenges, and I would say very heavily around suicidality. So we have that suicide prevention program. We're really looking to address those suicidal challenges that are coming up for them, the behaviors that come with it, some of that impulsivity and such. And then that kind of led us into also wanting to address co-occurring disorders. They might have multiple diagnoses, and so we'll treat them for that as well. We train all of our clinicians. They come in with their own specialties, but we really help bolster the care that they provide. We use a transdiagnostic CBT method that we train them in called the Unified Protocol. They also have the option to be trained in the suicide prevention program, which is the CAMS method. It's the collaborative assessment method for suicidality. And then if they're a psychiatrist, we have what we created, which is called Precision RX. So it assists them with quicker diagnosis and accurate medication dosage. So we're really able to treat a complex population. And then additionally, we've worked in the substance use disorder space for a long time, helping people kind of recover from whatever's going on with them in regards to that. So we can treat them at that outpatient level with the psychiatry and the therapy, or we can work with them more intensely on their substance use disorder. So our ideal client, I don't know, it's really an individual who's looking to resolve what's going on with them and needs to be in the comfort of their home in order to be able to do that. Maybe they have kids, or maybe they're a working professional or an executive who's looking for some more privacy. It just kind of can branch out in a lot of directions. But
Right.
yeah.
So that was something that was very interesting. We just got back from a conference where they were asking this very specific question of like, what is your secret sauce? What makes you unique? And I thought about you in that moment of like, okay, there are so many programs that are physical programs.
Yeah.
And so many people, you know, like that works for a lot of people, but there are so many other people that they have all of these reasons as to why they don't go to treatment, because they're a parent, because they have a job that they're afraid to leave. You know what I mean? And a virtual program is incredible. Like,
yeah, I mean, we're hoping to bridge the gap in general. There's a lot of these individuals. I mean, it's beautiful to have the ability to leave your home and to leave your family. And there are definitely times and scenarios where it's absolutely necessary to really fully immerse yourself in an experience and lock into your recovery journey, whether that's mental health specific or substance use disorder. That being said, there's a large population of people who are really needing to be at home and either aren't quite ready to take that big step and they need a bridge to just be willing to get into some kind of care, or who are coming out of a long-term program or a short-term program even and have to go back home and be able to pay their bills. I mean, it's a pretty big expectation on an individual to assume that they would be able to just uproot their life for a month plus and leave whatever they were doing behind and go into a program. So I think for us, the goal is to see who are these individuals who kind of need this middle ground, something where they can really receive intensive care, but not necessarily have to take their whole life and put it on pause.
Yeah, absolutely. What kind of payment structure is Brightside Health?
We are very much in network in all of our psychiatry, therapy, suicide prevention services. It's very much in network. That being said, our cash pay prices are incredible. You're looking at $299 a month for therapy, $95 a session for psychiatry, and then our IOP is a different price point, but it's a little more because you're doing a little bit more.
Yeah, of course.
People are able to still access it at a good rate. And then we also offer payment plans and things like that when absolutely necessary for somebody to kind of find their way through the process.
So you just said $199 for therapy. That's one session a month?
No, that's as many sessions as they need. Typically it's 4. I would say nobody's doing usually more than 4 sessions a month.
$199 for 4 sessions in a month.
Yeah, or more if they need more, if there's something else going on. Yeah, I mean, our specialty programs go up a little bit, but yeah. And then if they want to do both psychiatry and therapy, you're looking at $350.
Wow, that's incredible.
Yeah.
And what is your role at Brightside Health?
I'm our National Director of Partnerships and Outreach.
That's incredible.
Yeah.
What does that mean exactly?
What doesn't it mean? It's a very dynamic role, which is good for me. There's quite a bit of travel. I go to conferences. I work with a very diverse population as far as, business to business is concerned. We have over 1,500 clinicians as a part of our team. And so we're able to really help hospital systems. That's like a big population for us that we're able to support because they're usually looking for assistance in getting people access to care. And we are able to provide not only access, but quality access. We do a lot of peer-reviewed studies. We're able to track who's coming into our care, why they're coming into our care, how they've responded to our care. So our reporting is very, very strong. And then additionally, we can help corporations. So if they're looking to get care for their employees, to hopefully, I would say one of the biggest reasons that businesses come to us is because a lot of times their employee cost of care is so high that they end up not seeking it until they're in that emergency. So let's say they are suicidal, they're not really getting help until they have to go into a hospitalization. So we can kind of intervene earlier for them, help their employees get lower cost and better care sooner and quicker. And then also treatment facilities or programs. We're able to work with them for step-down options and really provide good aftercare. I think there's there's a lot of pressure on treatment centers that individual will leave their care and do really well after they're done. But sometimes 30 days, you go home, you're right back in your environment and you have no support. And so it ends up being reported that the treatment center failed when really it was the aftercare that fell through. Yeah. And so we're able to help them with that and kind of bridge that process for them. When they step down to us, we're not just taking them for IOP and then dropping them off with some random therapist and some random psychiatrist and they're getting lost in the shuffle. We're really taking them down through the whole aftercare continuum, which is beautiful. And then we're keeping track of them. So if they are relapsing or they're kind of going back into crisis, we can report that to those treatment centers, assuming that there's an ROI, obviously, and let them know, like, hey, your client is now struggling. They want to come back to care and really help loop that around. So that would be another avenue. And then psychiatrists and therapists, when they have clients who need a higher level of care, we're a great option for them as well. So it kind of is very diverse, but those are some of the people that I work with.
What was it about Brightside Health that made you want to work for their organization?
Well, I was in direct patient-facing care for over a decade. So my original form of my career was never going to be this style of work. I actually led mindfulness and hiking groups, and I worked with clinicians, helping them understand how to work with people in psychoses and not just say like, oh, clear your mind. Good luck with that breath work, really helping them understand what it was like to experience that breath work and language they could use. And so I did that for so long and I loved it so much. And eventually, a previous company I was at asked me to kind of take all of that information I had learned as we had built out a virtual intensive outpatient into the community and help people understand the value of virtual intensive outpatient. And it was at that time I started to identify, there's some like big gaps that are happening here within the not only patient experience, but in the process of them leaving care. Because one of the parts of that job was, okay, they're leaving our virtual intensive outpatient or our in-person one, and they're going to see the psychiatrists and therapists. But I don't know much about the way that the psychiatrist prescribes because it's different for each psychiatrist and what they're saying may not reflect what they're doing. And how do you really remove the guess and check method? And that was a little bit concerning for me. And then getting to know them and kind of learning about some of their practices takes a very, very long time because there's really, especially when they have private practice, there's no one there overseeing how they do it. They're the lead of their practice. So you're just really going off of whatever they say and then waiting and hoping that that patient will report back to you and let you know that it's going well. And very similarly, I would say with therapy, it's really hard to keep track of how they're doing with that therapist. And then additionally, the gap between provider to provider communication. So you're not seeing those two providers typically communicate unless they're within the same practice. So this individual comes from an intensive outpatient level of care where they're used to having wraparound support. Those teams are all communicating. The psychiatrist is letting the clinicians know how it's going. The clinician is letting the group facilitators know how it goes. And so you're seeing this individual get all of this care, and then they're just out in the community now. Nobody has any idea how they're doing until you hopefully hear back from them if they go into crises, which unfortunately the numbers show that will majority of the time be the case, that they need more support again, because that's just the nature of substance use disorder and mental health diagnoses. You don't get over it, right? It's a lifelong process of healing with these ups and downs. And so that kind of started to be something that I really felt like, how do we do this better? And what is out there that is better? And Brightside Health, it was one of the partnerships that I had when I was in that role. And so I was learning a lot about them. A friend of mine actually started what was very well known for a long time, started in 2010, Lion Rock Recovery, the very first virtual intensive outpatient in the United States. So that is the company that we acquired. And so I knew about Lion Rock Recovery. We went through that acquisition, and then I was learning about what Brightside did. And the more that I was learning about what Brightside did and how all of these providers were in communication and what it was like for an individual to get to go from that wraparound virtual intensive outpatient, all this support down through those same providers. All of that information is being documented for them. They're not having to uproot all their paperwork and take it all around and hope somebody will follow through and ask enough questions. You know, we're really looking at this, and then we're removing that guess and check method around the psychiatry, and we're tracking their symptoms, and we're seeing how they respond to medication, and we're taking that into account with the database of what we've seen with that diagnosis. We're looking really carefully at how that diagnosis responds to certain medications, and we're giving that individual infinitely better care that the majority of, I mean, maybe the psychiatrists out there will hate me for saying this, but majority of psychiatrists don't have that type of tracking available to them. Yeah. And they don't have as large of a data pool available to them because we've been doing this since 2017. We've been pulling this data from a variety. I mean, we have one of the most mixed populations possible. In certain states, we're taking Medicaid. Our cash pay prices are also extremely affordable. We're very in network across the nation. And so we're seeing high-end individuals, executive level, very, very rich people, and we're seeing very, very poor individuals come into our care. And so we're really getting a look at diversity and how they're responding, and across the board, they're responding really well to the care that we're providing. So it's very interesting to look at all of that. And that was what started to pull me in. I was like, hold on, this is a gap that actually needs to be filled. Yeah. And I want to be a part of that process. And then, I mean, on a personal level, the woman who was hiring my boss, Bayan McDermott, has been in this field forever and is a mom and has toddlers and really cares about what she does. And she really cares about partnerships and how we're showing up and how we're translating services within not only the treatment field, but in the world. And so I fell in love with her. Shout out to Bayan. And I really wanted to learn from her. Yeah. She was very interesting to me. The fact that she was raising a family, she was working full time, and then she was working in a way that felt meaningful and passionate for her. I was like, how are you doing this? Because I was, when I entered business development, I was 3 months postpartum. Oh, so wow. I was kind of drowning in the process and really looking for somebody to reach out and hold my hand and say, this is how you do it while being a mom. And this is how you set boundaries around your work schedule. And this is how you remember to stop and take care of yourself and do all of these things while still getting to build a career and have fun. Yeah. Yeah. It's a long-winded answer.
I love the passion you have for your company and your role at the company, which is a perfect segue into why you chose to sponsor Camp Soberfest. Yeah. I love the fact that you mentioned how hard our aftercare is right now for treatment centers. Like, there is just this massive drop-off. Why do you feel like Brightside Health and Camp Soberfest were aligned and that was something that you wanted to be a part of?
Well, there's things that happened at Camp Soberfest that surprised me that I didn't realize would be so aligned. But I would say previous to that, my thoughts were very specific, which is just because we are working in this virtual space doesn't mean that people don't need in-person connection. Right? It's like we can have both exist at the same time. And so being a person in recovery myself, I know how meaningful in-person connection can be. And I also know how beautiful virtual meetings can be. And that option, I mean, in motherhood, that saved my life. Yeah. So what you were doing was so fascinating to me. And you know, I've been a fangirl for a long time because I worked with you in my previous role as well. And I believed in what you were doing already. And I was trying to figure out a way, how can I support her in this process? Because as a person in recovery, I think a lot of these experiences that are done by treatment centers that are supposed to be these really magical, cool experiences require somebody to unfortunately pay a lot of money, including the retreats. And that's not to throw shade at anybody for how they put their business together, right? But as you can tell, my interest is how can we help people who can't normally access this care?
Yeah.
And what you're doing does do that. It gives them the opportunity to have connection, to be outside, to try things that they haven't tried before, to give themselves those healthy adrenaline rushes that they need, to be vulnerable, to have fun, to feel what it's, have this really exposure to what's possible. Right, which is such a huge part of my own recovery journey, not knowing what's possible for me and then being like, that's possible for me. You know, I could overcome that. And so Camp Soberfest is this little eclipse of that experience for somebody. And it's short enough that they can leave their life and go, potentially. Not everybody, obviously, but majority of folks are going to be able to go for a couple days away. And then additionally, cost-wise, it makes a lot of sense for somebody. It's not crazy expensive. It's not overcharged. It really gives them the benefit of both worlds, of that outdoor connection, the sobriety piece. And even if they're not fully in recovery and they're just interested in it and they want to learn and they want to see what it's like, it's a good exposure for a couple of days of what it can be like to be clear-headed and out in nature with other people, not centering yourself around those maybe normal socializations that you would do, going out and having a beer or whatever, in order to get yourself outside. So I just loved the whole process, and I love the opportunity to let our clients who have come through our program and want to experiment with that and learn how to build community be able to do it.
Yeah.
And then be able to, you know, sponsor it and sponsor somebody going like we did this last time around. I think all of it is really beautiful.
So you mentioned there was the pre and then the actual at camp. What was something that you realized at camp?
I think one of the biggest things I saw was, I mean, and I obviously know you already know about this, but people are getting hope in the moment, which is so rare to see. I mean, having been in patient care and working with those who had already made the decision to enter care, you see them at their worst, and then you get to watch them move through and grow and become a healthier version of themselves. But you don't really get to see what it's like for them when they are just being exposed for the first time ever to the possibility of a better life. That's something that even on a phone call that I would take for somebody who's interested in entering care, right? I still am not getting to see what turned them on to that possibility. And at Camp Soberfest, because you have this, I mean, there was somebody there with the 2 days and then somebody there with 36 years of sobriety. They're getting all of these opportunities to see what's out there and what they could have if they were willing to take this leap to get sober. But then additionally, what we experienced was the opportunity to get support for their mental health, because people were so open about their mental health journeys and what it's been like for them in recovery. And people with time, including myself, right, are like crying and being open on the spot about how beautiful this experience is. And so seeing those little lights turn on for people. And I was just talking to my boss about this, but I didn't bring any materials about Brightside because I wasn't planning on people coming up to me and being like, oh, I want to sign up for care like today.
Yeah.
I want to get, which is what happened there. I want to get psychiatry. And I was like, whoa, we don't even like, I didn't bring anything for you to give me your phone number, which is, I mean, how it would typically be done in general anyways at times. But it made me think like, wow, next time I want to be able to bring things so that they could look at the services and know what's possible for them to utilize and actually be able to understand it better than just, oh, wow, there's a therapy and psychiatry program here and an IOP program here. So I think it was really cool to get that opportunity to watch something like that happen for individuals where they were willing to be vulnerable enough to come over and say, hey, I need help more than what I have right now.
Yeah. And now a quick word from today's podcast sponsor, Brightside Health. Brightside Health delivers life-changing mental health care online, built around people's real lives. From therapy and psychiatry to specialized programs for elevated suicide risk, mental health intensive outpatient program care, and substance use intensive outpatient program care, Brightside connects people to high-quality support from licensed clinicians, often as soon as tomorrow. With in-network coverage across 150 million covered lives and evidence-based care designed to last, Brightside is helping more people access the support they deserve wherever they are. Mental health care should be easier to access, easier to trust, and built to meet people where they are. Brightside Health provides online therapy, psychiatry, and medication support, suicide prevention program care, and intensive outpatient programs for both mental health and substance use. Clinically proven programs combine compassionate human care with science-backed treatment, helping people feel supported every step of the way. Brightside Health is reimagining mental health care with a fully telehealth model designed to reach more people faster. Available in all 50 states, Brightside offers online therapy, psychiatry, suicide prevention program care, and intensive outpatient programs for mental health and substance use. With clinically proven care, in-network coverage across 150 million covered lives, and appointments available as soon as tomorrow, Brightside is making high-quality mental health care easier to access from anywhere. To learn more about today's podcast sponsor, please visit their website at www.brightsidehealth.com. And that specific moment that you were talking about really happened because of our Olympic races, I'm assuming.
Yeah.
So your team got to wear the Brightside Health logo on their T-shirt. They got to be represented by Brightside Health. People were making up chants and really like embodying this name, even though they didn't really know who Brightside Health was. What was that like as a sponsor and seeing people, kind of trying to figure out who you were? Like, why do I have this name on my T-shirt? What's going on here?
Well, I think what was really cool was that before we all went out onto the field to do the Olympics, one of the Camp Soberfest staff paused and said, hey, why don't you all take a second and learn about what Brightside is and what they do? And so we had that whole conversation about what we do and what was available. And then we went out and we did that team building. So then they had to have a real life experience together in this bonding moment. And I'm also there, obviously, as a direct channel for Brightside. So now I'm a human touch point that's relatable for them. And so I think that whole process, I mean, the Olympics is silly and it's fun, but it's also vulnerable. It's like you have to really be willing to look a little bit silly. You're jumping, your clothes are like moving all crazy. You're falling down.
Yeah.
People are relying on you. There's all of these vulnerable dynamics, and there's no, there's no shield. You're not drinking. You're not doing any of these things to block off what it feels like to have that connection happening in real time. And so I think it dropped people down a lot of layers. And then by the end of it, it was safe for somebody to come over and say, hey, you were on my team. You have these services. I want to actually talk about it. And I want to see what would be good for me and how I can get help.
Which is so beautiful.
I mean, it's like, it's a little bit emotional to think about. Being able to be a representation of a resource in a moment when that was not what I went in expecting, so it was beautiful.
Yeah.
Which I think is how camp is in general. It's a lot of moments that you unexpectedly engage in thinking this is going to be silly or fun and light. And then, I mean, the talent show is like a great example of that. And then you're just bawling, and you're looking at your friends and you're like, what just happened to me?
Yeah, we were just laughing 5 seconds ago about someone burping, and now someone's like reading.
Someone's sharing their recovery journey.
Yeah.
And what it was like in their disease to what it's like now, or just getting up to share their story to inspire somebody else.
Yeah.
I mean, really, really raw material.
Yeah. What was the most impactful takeaway you had personally as someone in recovery by going to Camp Soberfest?
I just took 15 years, right? And thank you. It's very shocking to be at 15 years. I feel like I'm 1 year sober still. But sometimes this far in, it's hard to remember how much that means for somebody who is so new and can't see past the day that they're in. Like that day is their hardest day. Most days for me are not my hardest day. Every once in a blue moon, I might go through something in a year that makes me go, man, I wish I could just turn this all off and just not, feel or think any of this, but that's a very rare experience for me personally this far into my recovery journey. And so to see people really needing to know, I mean, you get it in a meeting, but you get it, again, it's a snippet. You're in a meeting, you're there for an hour, you may be there for an hour and a half, maybe it's a crazy meeting, you're doing a 2-hour thing, but it's a snippet in time. Yeah. And so they get to hear a little story and then that's it. But this whole immersive experience, being around these people with time, seeing them have fun, seeing them love their lives, which I forget how meaningful it might be for somebody to see that I really love my life. Yeah. And I forget what it felt like in early recovery, looking at people with even 5 years. I remember thinking like, that was so crazy. Yeah. 5 years was nuts to me. I was like, I'd die before 5 years happens. Like, this is so, like the first year just shaking in my boots. This is so uncomfortable. Yeah. I'm crawling in my skin. And to see people really loving each other in those moments and removing what I think can sometimes accidentally happen in meetings, which is like old timer. Oh, you're an old timer and now you're like cool, you have more credit. And like really I felt like the playing field was so leveled. Like I'm no different than somebody with 2 days. We're all here experiencing these new things that we haven't done, that we haven't done together, and we're co-creating a reality right now. And that co-creation is that joy is possible, that hope is possible, that love is possible, that the removal of being better or worse than is possible, and that we can have these spiritual, raw experiences in community. And that they continue on, they keep unfolding, they keep getting better. That was what was crazy. Like it's like almost like the more a layer dropped off, the better the next round was. You know what I mean? Absolutely. And by the end of it, it's designed that way. When we did the fire ceremony with Adventure Recovery, I think we were all absolutely everybody who was out there that morning was on the same playing field, including Tim, who had dropped all of his layers too, I feel like, over the weekend, right? So like this man, 36 years, big name in the recovery community, in the field. And it was like he was the same as all of us, but he was leading us through. And I mean, we're all just crying, like letting go of things,
Really tired.
And then at the same time, getting to see people who are truly on the brink of their sanity. That might make me cry, but truly on the brink of their sanity. All their walls are down. They're letting it all go in that moment. And somebody with like a couple days more than them is grabbing hold of them. And then another person's coming up. And then another person's coming up. I mean, it's just incredible to see and to be a part of. And what a gift and what an honor to work in this field, to be in recovery, and then to get to add to that experience in some way and to have the ability to participate. Yeah. So for me, it's like the culmination of my life's journey and then my career getting to allow me to support it was just magical. Right? It's like absolutely magical. For me, it was a total godlike experience. I felt like I was with my creator and I was being just continuously shown that I was on the right path. Yeah.
How do you feel like camp rejuvenated your spirit of continuing to do this work for Brightside Health?
I mean, I absolutely think I was like, oh, we have to do it the next time and we have to show up better. Because I underestimated what it would mean to people for us to be able to provide access that quickly. I mean, individuals can come into our care within 24 to 48 hours. If they're coming through the suicide prevention program, they're going to be scheduled within the day, right? If they're going to do psych and therapy, they're going to be in there. They're going to have their appointment set up within 48 hours. If they're doing our IOP, you're looking at, 24 to 72 to get initiated and established with your pre-assessment and then put into care and scheduled for your first day, right? And their first day doesn't, because of the nature of what we offer, it doesn't have to start with a group. It could start with your therapy session or your psychiatry session. So it's very, very fast access for them. And so I didn't realize that people would want it like right then. That did not cross my mind. And so it made me think about, okay, well, when we sponsor in the summer, what am I going to bring again? What am I going to provide to help them understand it better, to not have me be the only representation, to actually bring things that can help support them in figuring out if this is the right choice for them, if this is the right avenue and process. And then obviously to see them want it and know that they need it made me very emotional and just feel touched that they trusted me enough to come over in that moment and talk about it and ask for help.
Yeah. And you made such a good point too. I think that there were probably even more people that wanted to ask for help and still hadn't broken that layer of ego yet. And if there was something on the table that they could have taken and called later.
Well, and you never know what's the access point for somebody. I mean, even I would say, obviously there was higher level of care programs there who do residential and so on. Maybe in that moment, they're not ready to go sign up, but you have no idea what happens on the next relapse when they go home. Yep. And now your team has met them and now they've built that relationship with you. And maybe they've taken your number or your program's information, or they have a loved one or a family member who's suffering. And now suddenly your program's going to be the one that they choose because they remember what it was like to be witnessed by you in that moment. And they remember what it was like for your program to participate and to be a part of and to show them what was possible, right? So it may not be that everybody, I mean, our services are very fast and accessible. There are some services that take a little bit more of a commitment. It may not be that it happens right then. But I think in this field and in recovery in general, like we really can't forget that just because something doesn't apply in the moment in which you share it doesn't mean that it won't apply down the line. Yep. Because I definitely know in my story, that's so often that somebody told me something then that didn't click until sometimes 5 years later. Yep. But that's how we build trust. That's how we build community, right? Is by actually finding ways to show up that people can learn to have faith in us and believe that what we're making available to them is worth their while. And not only that, that it's possible for them to utilize something like that and actually have a better chance at life.
Yeah, absolutely. What is your opinion on the difference between sponsoring something in the field of mental health and addiction where everyone is already very knowledgeable about, detox, residential, PHP, IOP. Like, I know when I first got sober, I didn't know what any of those things meant. I didn't, if someone would have said, oh, do you want to go to IOP? I would have been like, what does that even mean, Versus sponsoring an event where you're dealing with actual addicts and alcoholics. Like you said, some people showed up with quite literally 1 day sober.
Right.
How does that differentiate for you?
I think sometimes we're in a silo in the treatment field. We're with each other. And the reason why we're with each other is because we can help each other, help others, provide access to care at all these different levels. And we want to know about the programs and we want to see these things. And we want to make sure we're referring to a good in-person or virtual company, right? We want to make sure that those people who work there are great, all of that stuff. And I believe that that's invaluable to really get to know who your partners are, what they do, and how they do it. That being said, this is going to be specific, but I think about my friend Joey Price. And I was recently, we were just at the Lone Star Conference, and I was talking to somebody about how Joey Price got a family member of mine into treatment a long time ago. And the reason why Joey Price got that person into treatment wasn't because he was at networking events. He got that person into treatment because a partner I had at the time was talking with a family member of mine and she needed help. And I said, oh, well, he knows people. And they went to meetings together and he knew that Joey worked in the field. And he said, oh, well, you need to talk to Joey. And then they talked to Joey. And then Joey spent months trying to help this family member of mine get into care. Months. I mean, this person used to show up drunk, all these things. Joey would just spend time with them. And so when I was at the Lone Star Conference, I was talking about how much I love Joey. I'm a big fan. He now works for Navix. If anybody wants to learn about them, plug
Camp Soberfest.
Plug for Navix. But I was talking about how much I love him and how he helped my family member. And this individual was like, that's Joey. Joey's referrals all come from family and friends. Now, Joey no longer even does that. Navix doesn't do that kind of stuff today, and he still gets those calls.
Yeah.
And so we have to remember the responsibility that we have as those in the field, that if we're in a silo with only each other and our referrals are only coming from our little network of the people we know, then we are missing the opportunity to help our community and to be with our community, which is so, so vital to how people enter any type of care. And when I go to coffee, I mean, this is like random stuff. I go to coffee, I see a girl who went through some difficulty with her pregnancy journey and her birth journey. And she knows that I work in this space because we're friends. And she sees me sitting at coffee. She feels comfortable enough to come over and say, who do you know for EMDR for birth trauma that takes this insurance plan? I'm gonna be able to tell her.
Yeah.
And that kind of stuff happens to me all the time. So I truly believe it's vital to immerse yourself in the community and consider what it means, what those relationships mean that you have, right? And what you represent as a person in this field to those who don't know anything about what it is and what it means and what that level of care is. And how do we help people understand this if we're just in this tight-knit space paying all this money to go to these places to meet all these other niche individuals, right? We have to show up. The same way that, you know, if you're a member of the AA program, we have to keep going to meetings because people need to know that there is hope and that there are resources out there, and be an active part of society and be a pillar of hope for people.
Yeah.
Yeah.
You're incredible.
Thank you.
Well, that, for me, I feel like we covered it all, but
Okay.
do you have anything that you would like to?
I just really hope that people will remember that Camp Soberfest is a very light and free name, and it sounds fun, which is what it's meant to do. It's meant to sound that way because it is that. But it is also a space that I believe that other treatment programs should be involved in, because this really is kind of where the seeds are getting planted. And I think it's really important that we reconsider how we view something like this, that this isn't just a place to have fun. This is also a place to save lives. This is also a place to put your hand out. And this is also a place to put your arms around somebody who really needs it, and to let people know who you are and give them a chance to see what you do.
Absolutely. I think that is very lost on a lot of people, which is why we're doing this, because I mean, I'm not going to say the name of the program, but they just said, oh, no, we're not going to sponsor because we don't want anyone to think that we have anything to do with adult substance use disorder. And I was like, well, you don't understand. Like, we have so many parents that have children, that have issues, that that have no idea who you are and that you could help them, you know? And I just think that it's getting lost in this field, that everyone focuses so deeply on networking with each other, and they forget about the people that are actually out there.
We have to look at the numbers too, right? I mean, over 80% of the population is dealing with some sort of mental health diagnosis. And that's like probably a lowball number. That's from a couple years back when I was doing some studies, right? So over 80% of the population. Now, how many of those people actually are getting into care? And then, you know, if you really want to like get into that, how many people are able to actually Google search your program based on how things are designed now? It's very, very hard to pull up information that's not sponsored and that has the accurate SEO marks to get that ChatGPT little write-up now to actually deliver your program as it exists, right? So if you're not showing up and saying who you are and what you do in real time, and then allowing people like Camp Soberfest, brands like Camp Soberfest, to put your name out there in a real, genuine, and authentic way where people can have an accurate experience of your services, then those people are going to continue to turn to random places to get help. Majority of the time, the hospital, they're going to end up at the emergency department. Most people don't know your program. I mean, they might know it in your state, in your city, but how do you get people to know it on a national or international level, which we know Camp Soberfest now does, right? I mean, we had people from Canada, we had people from other countries that were there, right? Because of what they've seen on social media. So I think it's an underestimation of what's possible in providing information to the mass population about what you do, to say, oh, well, my specific population isn't there. Well, yes, they are, because they have friends and family who need services. And what's going to happen when they need to find those services? They're going to go and look at Reddit, Instagram, right? They're going to be looking these places where you're not going to show up because you're not being talked about there unless you're participating in a new and different way.
Right.
And I think, to me, what was most interesting about Camp Soberfest is that it is a new and different way. And it's a unique way for people to really understand what's available to them.
Yeah, I agree. Couldn't have said it better myself.
I don't even work for Camp Soberfest. I got no stake in the game. That's just my genuine belief.
Yeah.
And I think it's continuing to grow in presence. And obviously, we go to tons of conferences together, and the amount of people that come over to you and are like, oh my gosh, Camp Soberfest, when is it coming to my state? When is it going to be here? My treatment center wants to be involved. This program wants to be involved. How do I get involved with this? This will continue to be something that becomes more and more trusted and understood. So I also really wanted to make sure that we got in at the beginning so we could be a part of its growth process and support its growth.
Thank you so much for your support. I appreciate it.
Thank you guys.
All. Brightside Health, check them out. Thanks for listening to the Camp Soberfest podcast, your behind-the-scenes look at the people, stories, and experiences making sober living fun, connected, and meaningful. If you enjoyed this episode, be sure to follow us at Camp Soberfest on all social media platforms for updates, upcoming events, and more from our community. You can also learn more and stay connected through our website at campsoberfest.com. Remember, connection is the opposite of addiction, and recovery is better together. We'll see you next time.